So some of the tips and tricks, if I had to really dive in and tell you about some of my favorites, probably the top favorite that people don't often think about is that when you are taking care of a child, when they come into that exam room, the child, the parent, the teenager, and the parent, you have to think about, wow, I'm actually not only treating this child, I often also need to think about what issues are the parents bringing to the visit as well. So people may say, oh my goodness, why is this parent so obsessed with these two little brown spots on their child's skin when we know that this is going to resolve and it's not dangerous? Well, you have to think about it. If this patient has brown skin and their parent has brown skin, they have a long relationship with things that can cause dark marks on the skin that last forever. So sometimes you have to look beyond your patient and extend that to the family in front of you. And then that can often help you to be more compassionate, because the patient, yes, that they are coming there for a brown spot, but guess what? They're also coming there because their parent has decades of experience themselves and angst and about dark spots that just never go away. So they want to prevent that experience in their child. So just with that tip alone, it can really give you a new perspective on your pediatric patients when you see them in your office. So that's one of the huge things that I talked about in this lecture. Also, I like to drive home things that, you know, we who are experts in skin of color talk about all the time. Erythema, redness, being able to really recognize some of these basic things can really prevent children from having serious complications. For an example, there's something called staph scalded skin disorder, and you really have to be good about picking up erythema in the skin of infants and small children in order to pick up that condition, which a lot of patients are actually hospitalized from. So again, these same huge skin of color topics that we've been talking about for a long time, people may not think about them affecting a child's health and whether they'll be hospitalized or not. But that's an example of something that is carried over from the adult world to the pediatric world that really does matter. So, of course, for people who know who I am, I could not leave you without giving you a specific tip about children and hair loss. So we know that hair loss or alopecia is not a diagnosis. That is not a complete diagnosis. So of course, you know, we need to dive into what causes the various different types of hair loss. But in pediatric patients with more tightly coiled hair, this means that they're going to be more exposed to breakage, etc. This is the time to really try to teach the parents how to care for the hair and try to prevent things that we really have a tough time treating and counseling patients about when they get older. One of those things is called what? Traction alopecia. Traction alopecia. This is the time to try to prevent the worsening of this type of hair loss. So what I do in the lecture, one of the things I reveal is, how do I talk to a family about changing some of the things that they have done for years for their child's hair? And guess what? They've done the same thing to their own hair for generations. So you can imagine this information has to be delivered in a way that it can be well received, and that it does not matter what type of hair the doctor has. We want them to be able to feel, the parents to feel that this is a compassionate moment, not an accusatory moment, and that they leave with a sense of, wow, I didn't think about it that way. This is something definitely that I should think about. So here are my tips and tricks for that. So first, you really want to compliment the child's hairstyle. A lot of the hairstyles, especially when I was growing up, I'm an African-American woman, you know, and we would sit for hours to get these intricate hairstyles, and it takes time. And guess what? This is a sense of pride, having a well-kept well-kept hair on your child, right? So you want to compliment the hairstyle. Then you want to offer a correction to say, wow, your child's hair is so beautiful. Oh, wow, I know this took a lot of time, but say, you notice over here, it looks a little bit tight. And I think in order to really maintain her edges and see, I'm active on social media. So you have to speak the language of the people. So if social media is saying, we don't want to talk about traction and alopecia, we want to talk about edges. When you are delivering that information to parents, use the lingo that is cool at the moment. So you want to compliment the child's hair. You want to correct by saying, hey, I noticed it's a little bit tight, and then hit them right in the gut. I want to maintain her edges. And they'll say, oh, edges, I know about edges. They are difficult to maintain. I want my child to have edges when they get older. So that really hits them in the gut. And then this is something that I do. I actually, I didn't have a ton of time for this lecture. So hopefully they will, invite me back, and hopefully I can be invited back on this podcast. This would be great to give more tips about the third tip, which is to suggest that they do something different. And it would be more helpful to even talk about specifically what are some of the things they can do. Well, you may not be as well versed in little kid hairstyles, but you can at least suggest that it's loosened, or you not pull it back as tightly, so just general recommendations like that. So I'm giving you my tips here from Dr. Heath to you. Compliment, correct, and suggest. Compliment, correct, and suggest. So those are some of my top tips. Now, I can't give you everything because then you're not going to read my academic papers or come to any of my talks, right? So I don't want to overwhelm you, but those are some of my best tips.